My philosophy with taking care of patients is to treat each patient as if it was my own family member, giving them the advice that I would give to somebody in my family, so that when I'm complete and I'm finished with them, with that particular procedure or the services that I'm providing, that it's something that's going to last them for a good portion of their lives, hopefully forever, and something that is easy to maintain, and something that they'll speak to their friends about, something that they would tell other people. Boy, he really did a great job for me. He followed through on everything he said, and he gave me some great advice. As far as patients' expectations, it's very important to convey in a very accurate way what they can expect. It's much easier to have a satisfied patient when they're not expecting too much or more than I could possibly deliver. That being said, I found that most of my patients, their expectations and of their outcome are beyond what they came in with. So there are very few patients that actually come to me that I can't do what they thought they were coming in for. And in most cases, much more than they ever thought could be done. I've always, as far as part of a practice philosophy, I've always invested back into my practice, into instruments and techniques and upgrades to make the practice of dentistry easier for my patients and more precise. And it's just a huge, I get such a joy and such a kick out of doing things that my colleagues won't do or can't do. They've never even thought about doing it that way. And what they don't realize is that their patients are coming to my practice down the block because I'm just making it that much easier. I'm taking something that took 6 appointments before, and I'm doing it in an hour, and I'm doing it more effectively and better. And my patients love it. And all of a sudden I'm king of the hill because I'm doing things in a way that's so much more advanced and so much nicer. The biggest investment that I make, is continuing education. I go for at least 2 weeks a year, and usually longer, but an average of 2 weeks a year, just for extra continuing education. Most of it lately has been in the implant field, and having practiced for a long time, things tend to get a little stale. But when you're learning new techniques and new things, you just get re-energized each time. So a little bit is selfish in that I want to just soak up the new information and learn and be at the top of my field. And then the other part is my patients. Why shouldn't I have offered them the best there is out there?